Goedemorgen, mijn naam is Javier en welkom auf meine Weichin in Engels. Good morning, my name is Javier Martin and welcome to my presentation. And today I'll be talking about South Africa and the fight against HIV and AIDS and how PRTM can aid in that situation. So, a brief overview about what I'll be talking about. Um, First, we're going to start off with an introduction, and then I'll do a brief bullet point on how PRTM can really help change and affect this pressing issue that South Africa is faced with now. So, the reason why I chose South Africa is because it's a country that I grew up in, and it's a place that I hold dear to my heart, and I do have family there still. Um, South Africa is a regional leader within not only Africa itself, but in Southern Africa. The country has been recently impacted majorly by the new administration's initiatives. And unfortunately, South Africa has one of the highest populations globally with people living with HIV and AIDS. And it disproportionately affects women and young children. And it's sadly evolved into a discrimination and stigma based issue. And how PR team can help, they can help with increasing awareness and community-based support, and especially among children, and provide um, new ways of building up community using traditional ways that Africans are using moving forward. So, a brief country profile. The official name of South Africa is the Republic of South Africa. South Africa has three uh, capitals. Those are going to be the administrative is going to be Pretoria. Cape Town is the legislative. Bloemfontein is the judicial. According to the CIA World Factbook, South Africa has a population of around 60 million as of 2024. South Africa has 11 official languages, but when you're walking on the street interacting with people, you're mainly going to be hearing English, Afrikaans, Zulu, or Xhosa. And the rest of the languages are going to be other Black languages that are predominantly spoken in rural or sub-communities. Like the United States, they do have freedom of religion, but the three main ones that you'll find being practiced there are going to be Christianity, Islam, and Hinduism. The country is also very diverse, but instead of how we do it here, where you're ex-American, you're just grouped into one of three, and those are going to be whites, coloreds, and blacks. Unfortunately, over the last couple decades, South Africa has been rife with economic and political instability, and that in turn has affected their healthcare system because when I was growing up there, at least I remember, it was being a nationalized healthcare system, but recently it's changed into public and private. So, HIV and AIDS in South Africa. So, as previously stated, South Africa has one of the highest populations globally living with the disease, and that's going to be around 7 million people. Unfortunately, it's targeting mainly young women and children from the ages of 15 to 24. Stigma, like I mentioned, also has also disproportionately targeted and affected women. And South Africa is lagging behind when it comes to healthcare, and that being just general health for treatment for um, the disease, as well as mental health, which has also become a huge crisis because of the stigmatization and discrimination people are facing. Another issue that South Africa has had in combating the disease is the lack of education. South Africa ranks on the lower end of the scale when it comes to public education for children, and as well as communities suffer from economic strain and workforce reduction, not only due to the illness, but also just due to current the economic situation in South Africa. And one of the huge and main focuses for a lot of international causes is trying to eliminate mother to child transmission. So moving on to Botswana, shifting gears a little bit, but Botswana is another country that I grew up in, very dear to my heart, but they're actually a neighbor to South Africa to the north, and they are actually a shining example, not only for Africa, but the region, because they've effectively been able to eliminate mother to child transmission. Um, and they also served as a great model to show that you can have um, local government, national government, healthcare system, and other international entities. They can all work together efficiently and get things done. So this is highlighted, unfortunately, South Africa's slow progress and shows that they really need to get their stuff together because if their neighbors to the north can do it, then surely they can do it. So, global response. So, when it comes to AIDS in South Africa, you're going to have three main international organizations. There's going to be UNAIDS, PEPFAR, and WHO. So, UNAIDS has been the main vanguard in combating HIV and AIDS in South Africa. They are mainly there to focus on providing strategies for response teams and support, as well as collecting data from all the clinics and just having a big database so you know this person passed away, this person got their medicine, how's this person doing X amount of months or years since they last saw them. And they're also a big supporter of eliminating EMTCT, mother to child transmission, which they were actually successful. One of the main backers that helped push the initiative for Botswana to successfully get that out. And as well as they want to integrate healthcare, community mobilization, and end the stigma that people are facing. Now, PEPFAR, we're going to get into this a bit more in the next slide, but it's the President's Emergency Plan for AIDS Relief. This is a major fundraiser for um, making sure clinics are funded. There's an ample amount of medicine for people with the disease, as well as assisting with on the ground responses. So that's where CDC and State Department, where they're based in South Africa, helping with HIV and AIDS. They get their funding from PEPFAR. And lastly, WHO. The WHO, obviously, we all know who that is, main UN body. What their main goal is to try and eliminate AIDS from South Africa by 2030. And what they're trying to do mainly is help um, overcome those major obstacles that UN AIDS and PEPFAR can't really do as well. So that's mainly going to be ending the stigmatization. You've seen that's become a big theme. Healthcare inequality, that's going to be for people living in the posher areas, to people living in townships, to people living in rural areas, as well as poverty, and that those two go hand in hand. And another quick side note, PEPFAR has been around since the Clinton administration, so it's been around for a couple of decades. So moving on to current events, as we all know, President Trump won re-election to become the 47th president. And under his new administration, he has decided to make sweeping cuts to a lot of international projects or funding. And unfortunately, PEPFAR was uh, one of the casualties, and it has essentially been gutted since the president decided to give those executive orders. And it's had a really bad ripple effect on the ground. You're seeing a lot of clinics having to close down or overwork their staff. They're not being paid as much as they're paid, or if at all. Um, you're seeing them running low on supplies, and some clinics actually running out of the supplies. And it's just a bad situation on the ground where things are just falling apart. So because of this, we're seeing, according to Le Monde, the French article that I've been citing, they spoke with the French Ministry of Health, and apparently the French, Germans, the Italians also are going to try their best to subsidize what the US was funding, um, and just trying to pick up the slack where they can, but it's obviously not going to be enough because PEPFAR was funding in millions. Um, for this project. So moving forward to HIV and AIDS and how PRTM can work together. So here I have a list of just some collaboration and stuff that's already happened in the country. And one of my favorite ones is going to be the SAAVI, South African Advocation Vaccine Initiative. And what they're doing is they're trying to go community based, talk to community leaders, get people to understand you need to practice safe sex, you need to do XYZ. They do all that stuff, but one of the interesting things that they do is, as you see in the screenshot, they actually sponsor and host events for children mainly sporting events where they can have children that either have the disease from mother to child transmission or had been orphaned because a motherhood rates are high in South Africa, and they could be an orphan because the mother passed away due to the disease. So what they do is they host these events for children to understand that they're not alone in their situation, that there are other people like this, but there is a support system. There are people that have their backs. And I think that's pretty much what PRTM is about, is a sense of community and letting people know they're not alone in their situation. So some of the main challenges that I've found that are prevalent. So one, it's gonna be the South African healthcare system and government inefficiency. So that's gonna range from the fact that it's medical shortages, not only in just general practitioner medicine, but also with medicines particular to HIV and AIDS. Poor infrastructure, by that I mean they have hospitals that haven't been renovated since the end of apartheid. They have power outages and power rationing, which is a very common occurrence. So that's a huge challenge that is going to have to be overcome. Excuse me. Obviously, the cuts under President Trump's administration have caused major disruptions to HIV services. So that's another big challenge that's going to have to be overcome. And I also found that one of the interesting things about the public sector when it comes to their healthcare is that, according to the Ministry of Health in South Africa, they are serving around 84% of the population. So that's going to put it in perspective on how dire the situation is and the disparity between um, people that can afford the private sector healthcare. And then going into more rural, more PRTM focused, I think one of the main challenges is going to be understanding how to connect culturally with people, particularly those that are most affected who live in townships or in those rural areas where they don't have as much interaction with people outside of their community. And because of that, there's a huge sense of distrust, not only just stemming from the apartheid, but also because they're kind of left to defend for themselves. So PRTM is going to have to find a way to integrate with those communities and work with those community leaders. And so they could take the route of the South African Advoc- Awareness for Vaccine Initiative, where they're trying to do that, but it's still hit or miss. So my recommendations are going to be for PRTM to work with NGOs, community groups, and other governments. So, like for instance, the French, how they're sponsoring certain programs. PRTM can help do some can help connect with that. The sporting programs. So, as I mentioned previously, SA V VA. They sponsor football matches, soccer, swimming galas, cricket matches for these children, and that's one way that PRTM thrives, is building that sense of community for children. So I think that's a great way for PRTM to start. Next would be to build up the sense of community for people that are faced the stigma and are trying to get the mental health need assistance that they need. PRTM can really help um, figure out new avenues and come up with new ideas, since that's another issue that the United States has been faced with in the past recent years. And then during my research, I came across this really interesting global program called Girls Act. It is a female-led organization that is all over the world. They have um, operations in South Africa, Cambodia, um, Guatemala, Argentina. They're all over the world, mainly in underdeveloped countries. And what they do is that the leaders of that organization within the country are going to be women that have contracted the virus, faced stigma and discrimination, and they came out perfectly fine. So what they do is they work with these women, house them, feed them, and just let them know that they have their backs and they're not alone. And I think PRTM can learn a lot from that organization, not just in regards to um, HIV in South Africa particularly, but just in general. It's a great organization. I highly recommend that you um, do a little research and just check them out. They're a really cool organization. And then lastly, it's going to be citing what Lamond found is that cuts not only from the US, but also from the South African government. Um, there's going to be need to be a huge uptick in mobile outreach. So that's going to be people living in like the Western Cape and other townships not in main cities like Soweto, that's in Joburg. You're going to have to go deep into these communities. So, in conclusion, HIV and AIDS remains one of the most pressing health issues globally, not just in South Africa. And we need to figure out ways to help empower these young women, not only to teach them about safe sex, but also to teach them that they're not alone, that there are organizations out there to help them. And we need to help work with the South African government to figure out ways to help with the mental health crisis that's been attached to this issue because suicide rates have also gone up substantially because of this. And then community-based recreations, that's again going to be football matches, cricket events, swimming galas, those kind of things. Those really bring communities together. If you can teach people during a halftime or intermission during a gala, that would be about tenfold the amount of outreach that you could get instead of going door to door because they don't trust you. And then also just hammering in on the education from a young age and giving people access to condoms because if you have safe sex, you're probably not going to there's a lower likelihood that you'll get HIV and AIDS. And in my opinion, the UN sustainable goal of ending HIV and AIDS epidemic by 2030 has probably been hindered because of recent events under the new administration, but I do think that we can eradicate this disease at least in our lifetime. And to succeed in that, I think we're going to have to see a lot more investment into community outreach and public health, as well as um, ensuring that people understand that politicians are going to have to really step up and elect people that will work for the people and not just to enrich themselves. And like I've said, just empowering the communities from the ground up and ensuring that they know that they're not alone in the situation and that we're all human and we're in this together. So this is my reference slides. Thank you so much for your time and have a great day.